Are we live?
We are live.
Okay. Thanks very much. So, welcome back to This Week in Global Health, otherwise known as TWiGH. TWiGH is a weekly live global health news roundup. And this week we're going to be talking about food security and food insecurity, and we've got a lot of interesting stuff to get into. So stay tuned. We're going to jump right into our weekly news roundup from Global Health now at Johns Hopkins. Over to Brian Simpson.
Hi, everybody. I've got two stories for you today. The first is one that we're following on reports of 2 babies dying and 29 sickened last weekend in the southern Mexican state of Chiapas following vaccinations. So the government responded initially by suspending their national vaccinations, and but came out with the news today that it was actually bacterial in origin, external to the vaccines. They don't have know yet the type of vaccine. I'm sorry, the type of bacteria that caused this, or is the source of the bacteria. So, anyways, there's a story that we're gonna keep following because it has a lot of implications. In fact, some of the autism sites already have picked up on this and said, oh, you know, the vaccines are killing people and everything like that. But it looks like that's not the case at all. So,
Yeah,
and
okay,
the government has resumed.
We will always try and highlight the fact that vaccines are good, and occasionally.
Absolutely.
I mean, there's nothing that doesn't have side effects. There's nothing that doesn't occasionally have adverse effects. We know that. But in the case of vaccines, the overwhelming impact of vaccines is positive. They save lives. They've changed the world. So get vaccinated, everybody. Do it. Do it now. Okay, next story, Brian.
Absolutely. Our next one up is tying in with today's theme of food insecurity, and this is a Bloomberg Business report from last week about Angola. And Angola is the second largest oil producer in Africa. However, it is also has the world's highest rate of child mortality under the age of 5, with 1 in 6 children dying for every live birth. And half of those are due to malnutrition. And malnutrition stunts 30% of the country's children under 5. So as you're talking today, there's a lot of connections yet to be made in terms of preventing malnutrition, and even in a country that has actually relatively high gross national income, making sure that everybody gets the benefit of that and gets the nutrition they need is definitely an issue to be considered.
Right. Thanks very much, Brian. And that's a great segue to, so just a quick advert. That's Brian Simpson from Johns Hopkins. He's the editor of Global Health Now. It's it's a daily news roundup that comes via the email. If you don't subscribe, get subscribed. It's great. We use it all the time. We love it. We love Brian. Brian, don't ever change. Don't do drugs. Always do your best.
I love. Thanks so much, Greg. Signing off from Baltimore.
Cheers. Okay, so we're going to be talking about food security. Food is such a big topic. We're not going to manage to cover everything about food. We're going to literally just scrape the surface, and we're going to certainly do other episodes in the future that deal with a lot of the topics that we bring up in today's show. But let's start off by getting our heads around what it is that we mean by food security or food insecurity. And I wonder, Susan, if you could jump right in here and give us a bit of a definition. What do we mean when we talk about food security or food insecurity?
Absolutely, Greg. So the food security word first came out in a World Food Summit in '96 when they defined food security as when all people at all times have access to sufficient, safe, nutritious food to maintain a healthy and active life. Now, it's really interesting because lack of food security is food insecurity, and I so often get questions about how is food insecurity different from hunger, say? And usually I answer that food insecurity is an household measure, while hunger is an individual experience. So yeah, quite a lot of different terms being used here, but that's where it came out from.
And the USDA originally had that definition of food insecurity sort of being directly related to hunger, which we all know that on many levels it is, but it's important to realize that they separated the two statements because in their interpretation for reasons of measuring it and developing policy on it, hunger is because of a prolonged involuntary lack of food. You know, it's a personal discomfort, illness, weakness, or pain from that lack of food, whereas food insecurity is about the access, the affordability, and all of the factors that, like I said, give you access to that food. So there is a distinction between the two, and that's worth noting.
Chris, very quickly, I'd also like to kind of mention that in a food insecure household, different people might have different. So children might get impacted in a different way from adults, and that's also something to keep in mind when discussing food insecurity here.
Yeah. Oh, did we lose Greg again? We did. Okay, well, on that note, I know that we were going to take next to some of the WHO information that we have. Jessica, there's 3 pillars of food security. Can you tell us a little bit about those and what they are?
Yeah, so I'm glad you guys kind of talked about what is the difference between hunger and food insecurity or food security, whichever way we're talking about it. Yeah, because hunger is definitely more a physiological thing. It's a biological state that you're in, and food security or the lack thereof, insecurity, really have availability in how you use food. So WHO has these pillars of food security, and basically the first one is food availability. That means sufficient quantities of food need to be available on a consistent basis. It also has to do with food access, having sufficient resources to obtain the appropriate foods for a nutritious diet. And like I said, it also has to do with food use. This means that there's an appropriate use based on the knowledge of basic nutrition and care, as well as adequate water and sanitation that go into preparing food.
Mm-hmm. And you'll notice, so we're doing, and like we said, a series on food security. Now, why is it that we're concerned about food security? Why are we worried? Why is this important enough to make a topic? Well, to start, 1 in 9 people suffer from hunger, and that number actually increases to 1 in 4 in sub-Saharan Africa. That comes out to about 805 million people worldwide. And then you add to that the number of people who suffer from micronutrient deficiencies, and you're talking over 2 billion people, including 320 million children who are food insecure.
Exactly, Chris. And another reason that we're concerned about food security is that it impacts global health. So malnutrition, for example, accounts for 2.2 million under 5 child deaths. It makes people, and especially children, susceptible to diseases. It undermines their health, and it impacts their development and mental health.
That's so true, Katie. But while we're on the topic, I'm just going to ask you guys a simple question, and also the audience, please. So, say the first country that comes to your mind when I say the word hunger. Any guesses? What do you guys think of?
Ethiopia.
India.
Katie?
Bangladesh.
Interesting. Now, none of us chose a country like US, but this is just to highlight that there are 17.5 million households that were food insecure in US just in 2013. And this is really important to remember, that it's not just the countries in developing world or other continents that suffer from food insecurity. Also, developed countries such as US also suffer from it. So it's a global problem for global health.
It is. And I know that in the US, there's been a lot of campaigns that actually are talking about how 1 in 7 people goes without food. And I was listening to a podcast that recently discussed how there are actually countries, some of them being like Peru, Nigeria, where they actually go and discuss, families will sit down and discuss, okay, this is the day that we're not going to eat, or this is the day that we're not going to eat during the week, and collectively have to not just forego meals, but forego entire days of food.
Just quickly on that, Chris, since you mentioned Nigeria, 73% of income in Nigeria, majority of people, is actually spent towards food. So wow. Again, a link: food and poverty. Food prices rises, the chances of you becoming poor is much higher.
Yeah.
And certainly, if you're going to talk about the costs and how much this is, there's huge economic costs that are associated with food insecurity, and this is due to higher healthcare and education costs, and also reduced lifetime earnings. I mean, if you're malnourished, you may not get an education, you may get sick more often, so that's driving up healthcare costs. Or then if you're not sick, you can't go to work. So, it really, there's a lot of things that contribute to this. And I want to say that in the U.S. alone, food insecurity costs $462 billion in expenditure and 222 billion US dollars in lost output. So it's phenomenal, the costs that are coming out of food insecurity.
Yeah, I think we're also talking DALYs too, which is disability adjusted life years. So not just the expense of programs and things along those lines and interventions, but in the actual loss of capacity and ability of people to do normal work.
Yeah, and just to mention as well, your mental acuity is one of the first things that goes when you're hungry, and I'm sure none of us have experienced that kind of sharpness of hunger.
Yeah,
Hunger?
exactly what are you talking about? I think all of us has, but probably not to this severity that people are
Right.
chronically hungry.
Absolutely.
Yeah, I mean, we cannot expect kids to go to school and get a good education and get
Exactly.
themselves ready for a career
Mhm.
if they're waking up in the morning and they're hungry for the day. And
Yeah.
those kids are massively disadvantaged. And of course, that feeds into a cycle, right? Because those kids
Right.
grow up and are unable to perhaps secure good jobs because they weren't educated, and then their children land up in the same sort of poverty trap of food insecurity and lack of education.
Yeah.
Okay, so I'm back. I dropped off the show for a few seconds there because I'm experiencing what I refer to as internet insecurity, and my broadband is awful. And so I've re-logged in using my cell phone's 4G or something. So you may lose me again. But while I'm here, Katie, will you talk to us about some of the challenges in the area of food security?
Definitely. I mean, there's a lot of things that are connected with all the subjects we talk about. So things like the global water crisis, which we touched upon a few weeks ago, that impacts food security. Land degradation, desertification, huge impact. Climate change, agricultural disease, food price shocks, population growth, and loss of biodiversity, just to name a few. There are tons of these issues that are interconnected and connect to food.
Yeah, I think we should actually do an episode. I mean, each one of those issues could be a standalone episode,
Exactly.
to be honest. I mean, and
Very
with time, I think we will actually focus in on each of those in particular. I would love to do an episode at some point on food price shocks, because I mean, in 2010 about 2010, we saw the first really severe food price shocks, and it had huge impact on low-income countries, and particularly poor people who spend a lot of their income on staple foods.
Totally.
So that's super interesting. We don't have time to get into that in this episode, but it's coming up, so stay tuned. Sulzan.
Yes. So I just wanted to quickly mention, talking about food price shock, recently, like with the Ebola epidemic, just in Sierra Leone, Liberia, and Guinea, there were 1.2 million people food insecure because of the food price shock result of the pandemic, which is set to rise up to 2.2 million by June. So just wanted to give an example quickly.
Okay, that's interesting. And one of the things that's going to contribute to food price shocks in the future is going to be climate change. And so, Sulzan, back to you. Can you talk to us a little bit about climate change and food security?
Absolutely, Greg. So there are 7 billion people in the world. This population will be 9 billion by 2050. As a result, the food production needs to double, and it's changing. That it's expected to cut crop yield by 25% in the future. So here is the million-dollar question for you: how do we feed the world? Like, do GMOs hold the answer? Is that what we're talking about? So climate change is impacting food insecurity.
Well, interesting that you brought up GMOs, and I'm sure a lot of people watching this show will be interested in GMOs, and we know it's controversial. There's arguments on both sides, so we're gonna focus in on GMOs for a few seconds here. I'm gonna ask Chris to kick off. Chris, talk to us about GMOs. What are they, and what are the issues?
Okay. Sorry, Sulzan, to have laughed at the last one. Your computer went like dubstep on your microphone. I wasn't laughing at the severity of climate change and the relationship to food insecurity.
It actually sounded quite funky. We just needed to get in there. American would have a hit.
Well, okay, so to go back to GMOs, as Greg said, actually, in order to have food security, availability, and accessibility, we need to be sustainable and resilient to food system shocks and price spikes and things that come our way. We're finding that as globalization of food increases, as the population rises, as the climate rises, that the population in the food system becomes more fragile and susceptible. And I think something that's really important to consider, I listened to a fantastic podcast from the Carnegie Council in Ethics and International Affairs called Full Planet, Empty Plates. And they put out some statistics there that really sort of changed the way that you look at this dialogue. The first is that, there are 3 primary agricultural crops, grains, and there's wheat, rice, and corn. Is actually the annual output of corn is as much as rice and wheat together. Now, there's a lot of factors that have to deal with food insecurity, including population growth, pressure on our resources, diminishing water tables, as well as rising affluence in the world. People in China are eating twice as much. I think China is consuming twice as much meat as the U.S. is, and that's not per capita, but because of just the expanse in population. And there's a lot of grain that goes into feeding cows. What we're seeing is that for crops like wheat, a 1% degree Celsius rise actually diminishes the annual production of grain by 10%. That was the old belief. A new study by Stanford actually says now that it's 17%. So every, again, 1 degree Celsius change is a 17% reduction in output of grain. And so now that we're looking at these changing dynamics, this increase in population, the fact that in this century we are going to have multiple degrees Celsius change, how are we supposed to meet the needs of all of these populations? And GMOs is one of the methods on the table. And I know that Sulzan, you've got some really interesting thoughts and experience in this field.
So, Chris, it's great to mention GMOs here, and I feel GMOs are one of the often misunderstood tools regarding food insecurity and reducing it. In fact, for example, did you know that crop biotechnology and GM crops has reduced pesticide spraying by 550 million kgs in just last 20 years?
Wow.
And what's interesting is it is equal to the pesticides which is applied in just 2 years within the EU, where GMOs are banned. So that's one side. You're looking at, and with the changing climate and altered weather patterns, you're seeing a rise in pests and fungus. For example, in northern India a couple of years ago, yellow rust fungus led to destruction of much of the region's wheat. Now that's a problem that can be solved by GMOs. Another area why I feel it's really important for food security when we talk about deficiencies and micronutrient and nutrient deficiency, there is the example of the golden rice. 250 million children suffer from vitamin A deficiency. It is a leading cause of preventable blindness. And there is rice, which has vitamin A, which can be used to solve that problem. But it's there, but people are not receptive to it because there's so much of misconception about it. So again, I'd love to kind of continue this conversation in discussion further, but yeah, GMOs are not bad.
Yeah, there is a lot of controversy, and I think it depends on the context, and that's something we'll delve into after we hear from Jessica and Katie in this one. But I know that there's a lot of opinions at the table here and a lot of opinions across the world, so I'm excited to hear everybody's. And if you're watching, tweet us, let us know your thoughts, let us know if you've come across an interesting article. There's a lot of literature out there, so help us aggregate it.
And just so that you know, if you're watching this on YouTube or listening to the podcast, those people that are watching the show live, the show actually continues on past when we ended, and we just have a discussion, and so a lot of this discussion will carry on online for the live audience late into the night. It'll be very exciting stuff. So everyone will, we'll see the team get their gloves on and see what happens. Okay. That would be interesting. Okay, Chris, could you talk to us about what organizations are out there that are having an impact or trying to address the issue of food insecurity? And in particular, I mean, of course, a lot of our audience who are interested in working in this area might be looking for a place that they might look for a job. So who's out there? Who's doing what? Who are the stakeholders? Chris. So I can't hear you, Chris.
Chris, you're on mute.
I tried to be all prepared and quiet, and now I'm got it together. I said there's a lot of different organizations out there that are dealing in agriculture, in malnutrition research, and in food security and insecurity. A lot of different stuff. We're going to name just a few of them, but there will be a very comprehensive list in our show notes, which will be moving to our website. So be sure to check those out. I'm going to list a few. We have the Food and Agriculture Organization, the World Food Program, the Food Research and Action Center, or FARC, Children's Health Watch, the Micronutrient Initiative, and many, many more. So if you're interested in that space and want to check out a lot of these organizations, what they stand for, where they work, be sure to head on over to our website, twig.org. And we lost Greg again. This is the best. Okay, well, before we go to Katie's Career Corner, which I think is going to be an excellent way to end the actual show, let's hear from Jessica and her research update for this episode.
Right. All right. So we've talked a little bit about food insecurity and about the challenges associated and how it affects health. But there's probably also a lot of ways that you don't you wouldn't think of how it affects health. For instance, there was a study published last month in BMC Public Health that looked at how food security affects the uptake of prevention of mother-to-child HIV transmission in Zimbabwe. Now, 33% of Zimbabwe's population is undernourished, and 12% of pregnant women are HIV positive. So you can see that this is a significant concern for this country. And through a cross-sectional survey of nearly 8,800 recent mothers, it was found that the most food insecure mothers were 14% less likely to have completed all steps of the prevention of mother-to-child treatment cascade in comparison to food secure mothers. Now, this cascade includes visits to antenatal clinics, getting tested for HIV, knowing your HIV status, delivering in a health facility, using antiretroviral therapy, and a number of other factors. The study also found that among HIV-infected women, food-insecure women were more likely to have given birth to an HIV, or the infant subsequently became HIV-infected. Now, the effects here aren't huge, but what this does do is it gives some indication of how food insecurity could be a barrier to prevention of mother-to-child transmission. It could be through adherence to treatment. People probably don't think about it, but HIV drugs have side effects, and they're worse on an empty stomach. And there are also competing priorities for food insecure women in whether they decide to complete their antenatal care or their prevention of mother-to-child transmission services, or instead try to feed themselves and their family. So, you know, here's an example of something you may not think about, but food insecurity affects a lot of things.
Definitely, definitely so. I know, Sulzan, did you have a quick comment that you wanted to make on that?
Yeah, I just wanted to quickly say that you also see that with TB medications, you know, people don't like taking antibiotics on empty stomach, and you know, that also impacts TB outcomes. So just quickly.
Yeah, no, very much, very true. And then Katie, over to you for Katie's Career Corner. How can people help in this space, and what initiatives can they get involved in?
Yes, well, I'm happy to share that information on Katie's Career Corner this week. So I have two jobs, as per usual. The first one I wanted to go over is actually an internship with the World Food Program. Now, many people don't know, but the World Food Program is kind of associated but not part of the UN WHO system. So actually, their internships have a stipend. So there is a program and policy division knowledge management internship, and the job description has details like you have to support a historical review of operations, contribute to enhanced standardized knowledge management process, support efforts in the division, perform any other duties related to the division as required. The candidates are asked to be currently enrolled or recently graduated from a bachelor or master degree, have attended courses in the last 12 months, proficiency in MS Office, fluency in English, and intermediate knowledge of another official UN language. That was interesting. Or Portuguese, because that's the World Food Program's working language. So the link will be on our website and in the show notes for you to apply. The second job is from an organization called Cultivating New Frontiers in Agriculture, and it's an international development organization that specializes in designing sustainable, market-led agricultural initiatives, and they're looking for a program development officer. This is mostly to do with helping with proposals and technical writing and working on partnerships. They ask that you have a minimum of a bachelor's degree, master's preferred, and a background in agriculture, agribusiness, nutrition, food security, finance, international development, or other, and demonstrated knowledge of USAID proposal development procedures is preferred. Again, that job description will be on our website and in our show notes, so check it out.
I'm going to apply for that.
Thanks very much, Katie. So, am I back?
You are back, and you are taking us out.
Okay, I dropped off again, but I'm back. Well, I'm back for the end. This is the end of the show. Thanks for watching. If you're watching live, don't go away. We'll carry on. Otherwise, just to let everyone know, there's a number of ways you can be in touch with us and interact with us. What we're trying to do here really is develop a community. So this isn't meant to be just a one-way broadcast. We want to hear from you. We want to interact with you. We want to hear. We want you to be part of this discussion. You can get us at our webpage. On our webpage, there's a form that you can fill in and push submit, and we get those. We'll email you back. You can email us at hello@twig.org. The webpage is twig.org, www.twig.org. We've got a Twitter thingamabob. We've got a Facebook page. We've got a LinkedIn page. We've got a blog. We've got a podcast. Lots of ways for you to interact. We'll have links to each of these things in the description below this video on YouTube and in the show notes that'll be on our webpage. So check it out. Okay, same time, same place next week. See you then. Take care.